Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine Podcast. I'm your host, Yaron Ivan, as usual, and today some more important rules that hopefully will help you take care of your patients. Rule number 138. If it does not work, change something. This, I think, is a very good rule to practice, especially when doing procedures. Commonly, in lumbar puncture that I often do in the pediatric emergency medicine department, mostly on neonates, but sometimes, thankfully not often, I get a dry tap or just blood and I'm unsuccessful in doing the procedure. In this situation, I always try to do something different. Maybe try to go at a different level of the spinal cord, maybe lay the patient if the patient was sitting up, but try to do something different in order to hopefully be successful. Another good example is intubation. Certainly a very important procedure that I don't do very often, but sometimes when I am about to put in the tube and I cannot see the cord, I try to change something. Maybe a cricord pressure, maybe try to use a smaller tube, maybe use a glidoscope or a bougie. But if I'm unsuccessful in doing the procedure, namely seeing the cords before I put the tube in, I think it's important to understand that maybe you're doing something wrong and it's probably a good idea to try and change something about how you do it. Now, procedure is just one aspect of this rule. This can also be applied when talking to a parent. If you're trying to relate a certain point to a parent about a test you want to do or something that you think the patient needs, and the parents don't seem to understand it, maybe they're a little angry, etc., try a different approach. Try explain it in a different way. Just try something different if what you have been trying has not led to success. So rule number 138. If it does not work, change something. Rule number 139. 3 strikes and you're out. I learned that rule from my pediatric emergency medicine fellowship director, Dr. Nael Spears. I actually learned it from Sally Reynolds in her residency. Shout out to Sally. And this rule basically speaks to the fact that if the patient visits the medical system, and it doesn't have to be the pediatric emergency department, 3 times over a short period of time, open your mind. Maybe us, the physicians or the system, are missing something. Why is the patient coming back 3 times? Now, I do agree that many times under those circumstances is because maybe mom misunderstood or the parent misunderstood what are the reasons to return to the emergency department and what is the normal or natural course of the disease. Sometimes parents think that the viral illness will get better in a day or two, and if it's not like that, they worry and come back. Sure, under those circumstances, there's not a whole lot to do, but the point of this rule that if the patient has been seen by a medical facility 3 times, it's time to open our mind and see if we're missing anything. Even if it's just we are failing to give good anticipatory guidance, something to the extent that the natural course of the disease may be longer than we thought, or may be longer than the mother was thinking. The point of that rule is that we all need to open our mind when something is not right and the patient is being seen so many times. Maybe there's a disease course we're missing, maybe there's a test we can provide to pinpoint the problem, etc. Rule number 140. Remember, endorphins are neurotoxins. I heard that from Dr. Adam Adler, a pediatric anesthesiologist who's been on the show before, and we actually went to medical school together. And this rule basically comes down to basic physiology that when we are under endorphin situation or fight or flight response, we often don't necessarily do the right thing. So endorphins are kind of neurotoxins. They give us tunnel vision. They don't help us see the whole picture. Oftentimes there's a lot of stress and possibly a lot of confusion. It's important under those circumstances to maybe take a breath and maybe delay your decision if you can. Try to make a decision and move on when you are in a better state of mind. Don't be pushing yourself to making a decision when you're not calm, cool, and collected. This is similar to a rule I discussed in the past. A good ER doctor never runs. Think while you're walking fast. When you're running, you're under the influence of endorphins and possibly will have bad judgments and make mistakes. A good ER doctor never runs. Think while you're walking fast. And remember, endorphins are neurotoxins. When you find yourself under the influence of endorphins from the situation or from being out of breath or whatever, try to take a deep breath and focus before you make another critical decision. Rule number 141. Act as if your trainee is watching. I learned that rule from Dr. Barry, another colleague of mine who actually did residency together with me in Massachusetts. I'd like to give her the credit for the rule, but I think this is a very good rule for those of us who work with trainees. I think we all know and agree with the phrase lead by example, but I think we often forget to do that and forget that our trainee is watching and they're actually watching everything we do. The way we talk to the patients, the way we practice medicine, the way we speak to our nurses, the way we interact with child life. So I think it's important to keep in mind that we should always act as if the trainee is watching. Speak politely to the parents, be as professional as we can to the nurses, etc. It's just a rule to keep in mind when you have no trainees around. Again, we all try to lead by example, but I think it's important to behave as if we're trying to lead by example even when there's no learners around us. So when the residents are not there, when the medical students are not there, we still act professionally, we still do our best, and we always try to do what's right for the patient no matter what. So remember rule number 141. Act as if your trainee is watching. Thank you, Susie Berry, for this rule. And that is it for today, guys. Thank you very much for listening. I appreciate it. Please continue to check out PEM Rules and submit any feedback for the show. If you want to come on the show, I would love to have you. Send me an email, send me a message, and we can see how you can get involved and help PEM Rules. The following is one of the most fun bass lines to play, Stand By Me by Benny King. Hope you like it.